Welcome to Mastering Differentials, an approach to clinical medicine history taking. I am Dr. Fahad Khalik, and in this video, we're going to discuss about different presenting complaints and symptoms and a diagnostic approach to history taking. So sit tight and follow along with me through this whole sketch, in which we're going to start from the constitutional symptoms. So starting with the constitutional symptoms, we have a mnemonic, and that is SWAN beside CPR. Now, what does that stand for? Sleep, weight, it could be weight loss, it could be weight gain, A for appetite, and N for night sweats. Then B beside, B stands for bone pain, and CPR. C stands for chills, P stands for pyrexia, and R stands for rigors. So let's draw a scene where the girl is giving CPR to the boy and the swan are beside it. Now we start our first constitutional symptom, that is sleep, and we're going to represent it by an old man who is just sleeping on the bench. So a patient can present to you with the loss of sleep, and this is known as insomnia. And in that case, you're going to ask about the normal sleep pattern of the patient, followed by change in the sleep. Then you're going to ask about the timing of insomnia, if it is hard to go to sleep or is it hard to wake up in the morning. Then we're going to ask about the associated symptoms with the loss of sleep, and these could be anxiety or depression. Now we're going to represent anxiety with this anxious pop-up balloon and depression with this semicolon pop-up balloon. What else are you going to ask about the patient? With the loss of sleep, you're going to ask about any cardiac disease or any respiratory disease or any other cause of pain, which are represented by the hospital with the logos of heart, lungs, and shock. Now I think it's time to move on to the second constitutional symptom, which is weight loss. And by weight loss, I mean significant weight loss, which is just drop in more than 5% of the total body weight in 3 to 6 months. We're going to represent this weight loss with the weight having an arrow that is going downward. Now, for the weight loss, we have common causes, for example, infections like TB, endocrine diseases, for example, diabetes, hypothyroidism, Addison's disease. We have liver diseases, for example, hepatitis, DCLD. We can have chronic renal failure, malignant diseases, for example, lymphomas, leukemias, carcinomas of stomach, colon, liver, pancreas. We can have different blood diseases, for example, anemias. We get the weight loss. And in the psychological symptoms, for example, anorexia nervosa, bulimia nervosa, we get the weight loss, and we can have miscellaneous causes, for example, malabsorption syndromes or the infestation by the worms. Now, in a patient with the weight loss, you're going to ask about the collar size of the shirt. Has it decreased significantly or not? Then you're also going to ask about the onset. Is it recent weight loss or is it chronic? Now, the recent one is more significant. And finally, you're going to ask about the normal dietary habit of the patient to separate out the physiological weight loss from the pathological one. Now, let's talk about some associated symptoms which you're going to ask the patient. First of all comes the tuberculosis, which is represented by this cavitary cacti. In that patient, you're going to ask about cough, sputum, hemoptysis, fever that worsens on evening and night sweats. And now it's time to ask for the cirrhosis of the liver, which is represented by this cirrhotic tree. In the patient of DCLD, you also get to see weight loss. And in that patient, you're going to ask about jaundice or abdominal distension. Next, we can have weight loss in a patient with chronic renal failure, and you're going to ask about nausea, vomiting, and metallic taste of the mouth. And this chronic renal failure is represented by these hanging injured kidneys with the tree. Next up, worms infestation. Now you can really ask the patient if they can see worms in their stools. And here we're going to represent this worm infestation by these worms which are going above the tree. What are they going after? Well, good question. They're just going after a jar of sweets and candies, maybe? Yes, you're right. They're just going after a jar of candies, which is going to represent the diabetes. So, in a patient with diabetes and weight loss, you're going to ask about symptoms, for example, polyuria, polydipsia, or polyphagia. You can also ask this patient about the complications of diabetes, for example, any past history of cerebral vascular accident, MI, stroke, or peripheral arterial disease, which are actually the macrovascular complications of diabetes. You can also ask about the microvascular complications, for example, retinopathy. Ask them if they appreciate blurring of the vision, flashes, floater, which indicates cataract. Also ask them about the symptoms of kidneys, for example, froth in urine, which is going to tell you about proteinuria, or simply you can ask about the frequency of micturition. And finally, the third microvascular complication, you can ask about the tingling, numbness, burning feet, which are just telling you about the neuropathy. Next, we can have weight loss that is associated with the hyperthyroidism, and that is represented by the thyroid purple bow on the girl's neck. Now, in a patient with the hyperthyroidism, you're going to ask about the intolerance to heat, tremors, excessive sweating, or you can just see a thyroid swelling in the neck. Moving on to the next associated symptom of weight loss, we get anxiety and depression. Next up, another strong association of weight loss is with leukemia and lymphoma. So you're really going to ask the patient about lymph node enlargement. Do they appreciate formation of these subcutaneous nodules in the neck, axillary, or groin region? And if they say yes, you better keep tuberculous lymphadenitis, lymphoma, and lymphocytic anemia in the back of your mind. Just like leukemia and lymphoma, we can also get weight loss in carcinoma. So we're going to represent this carcinoma with a cancer crab symbol. Now, if a patient has weight loss with a carcinoma of stomach, they're going to come with a dyspepsia, vomiting, with or without hematemesis. And for example, if they get colorectal carcinoma, they're going to come with a recent constipation, tenesmus, and blood in stools. Now, this cancerous condition is really strongly associated with the weight loss. Well, what more can we expect from a patient with a weight loss? Well, glad you asked. We can always expect malabsorption syndrome, which is represented by this bulky, frothy, greasy stool. Ah, she's giving CPR beside a poop? Ew. So let's go somewhere else and find more constitutional symptoms, and look what we got. The appetite store. And this appetite store has two parts, one with the increased appetite and the other with the decreased appetite. First, we'll talk about the conditions in which appetite is significantly increased, and first of all is the thyroid. In hypothyroidism, the appetite is significantly increased, which is represented by this purplish thyroid bow on the girl's neck. Now let's see what else she has to offer. She is selling some jar of candies. Well, she's selling actually diabetes. And what else? She's selling poop. A yellow, greasy, bulky, frothy poop. Well, I know what is it. It's just malabsorption syndrome. Hey, ma'am, look out. The worms are coming for your sweet candies. Ah, help, help. This is worm infestation. So the appetite is technically increased in hypothyroidism, diabetes, worm infestation, and malabsorption syndrome. That's enough for increased appetite. Now let's talk about the conditions in which appetite is significantly decreased, and we got here a cancer crab. So in these cancerous condition, like I told earlier, the appetite is significantly decreased. What else do you have to offer? Ah, eggs. Eggs? But these are suspiciously looking like lymph nodes. So in leukemias and lymphomas, the appetite is significantly decreased, and the patient is going to come to you with the presenting complaints of lymphadenopathy. And now we have a beautiful decoration piece between these two markets, which is suspiciously looking like a cirrhotic tree. Oh yes, it's DCLD. So in cirrhosis and decompensated chronic liver disease, you get reduced appetite. And whoa, wait. This boy has one more thing to offer, and that is an injured hanging kidney, which is just telling you about renal failure. Oh man, you're just selling a lot of stuff. Doesn't this just give you anxiety or depression? Oh yes, of course you do get. So in anxiety and depression, you also get reduced appetite. You have a beautiful cavity cactus in the front of the shop, which is just telling you about the tuberculosis. Next up, we get the Addison's disease, and this is represented by Addison's logo. So Addison's. So in the Addison's disease, you get reduced appetite, and I think now it's enough for the appetite store. We'll check up later. Now it's time to move around and find the other constitutional symptoms, and look what we found. We found a skull with the bones, which is going to represent bone pains. Now, this bone pain is strongly associated with the cancer if there are big bones, and it's also associated with lymphadenopathy. And this lymphadenopathy is represented by this necklace, just looking like lymph nodes. Anyway, so bone pain is also because of trauma. So make sure you take a proper history. And this trauma is represented by this axe, which is just stuck into the head of the skull. And you know what's worse? With this axe is attached some weight, It's just telling you about the weight loss. So in the bone pains, you really need to keep cancer, lymphadenopathy, trauma, and weight loss under strong differential. Okay, I think it's enough for the bone pain. Now let's move to the night sweats. The night sweats is caused by TB, B symptoms, for example, in Hodgkin lymphoma, leukemia, and brucellosis. So for the night sweats, we start by drawing the brucella cow. Now this cow is really telling you about the brucellosis. Now this cow has a beautiful strap in the neck, and on that strap is written B. Now B stands for, the brucella cow, and also B stands for the B symptoms of Hodgkin lymphoma, leukemia, and so on and so. Next, in the chemistry cactus, tuberculosis, we can also get these night sweats. Okay, so until now, we have covered a lot of constitutional symptoms, for example, sleep, weight loss, appetite, bone pains, night sweats, and now let's move on to rigors and chills. Now, do you see this couple of zones? Well, they're very toxic in their relationship and they're also floating in a toxic water. Now, this toxic water is represented by this toxic sign, and this toxin sign is also the sign for septicemia. So, these swans are basically floating in septicemic water. What? Also, this pond is very dirty. You can see an apple pie at the edge. So, in pyogenic infection and septicemia, you get rigors and chills. So to add fuel to the fire, or you can say just add more germs to the already dirty water, here are the mosquitoes bringing for you the malaria. So basically you get rigors and chills in malaria, septicemia, and pyogenic infection. Now let's move to the final symptom, and that is fever or pyrexia. Now the fever is something that is about 99 degree Fahrenheit or 37.2 degree Celsius. Now, to talk in general, the fever has a lot of causes. For example, protozoal infection, malaria, you get fever. In the bacterial infection, you get fever. For example, typhoid, TB, pneumonia, empyema, lung abscess. In viral infection, you get fever. Influenza, measles, mumps, autoimmune diseases, you get fever. For example, rheumatic fever, SLE, or dermatomyositis. And some malignant diseases, you get fever. For example, lymphoma, leukemia, and you get iatrogenic fever, that is drug induced, and if there is no significant cause, you can just call it habitual hyperthermia. So to summarize, there are just a lot of causes for the fever: protozoal, bacterial, viral, autoimmune causes, malignant diseases, or it could be just iatrogenic fever. Now, when a patient comes with the fever, you have to ask about the duration of the fever. Is it just short duration or long duration? If it's short, it's mostly like because of just minor viral infection, pharyngitis, tonsillitis, or if it's just long, it could be chronic malaria, enteric fever, TB, brucellosis, autoimmune diseases, or just malignant diseases. Next up, you're going to ask about the onset. If it's sudden, it could be malaria, it could be pyogenic infection. If it's gradual, it could be enteric fever, TB, brucellosis, connective tissue disorders, or if it's with rigors, you get the malaria, septicemia, and pyogenic infection from our swan's dirty pond. Next, you're going to ask about the severity. If it's low grade, that's because of tuberculosis, brucellosis, connective tissue disorders, or some malignant diseases. If it's high grade, that could be because of any other disease. For example, it is in meningitis, pneumonia, pyogenic infection. And one more thing, don't forget to ask about the character of fever. If it's intermittent, if it's remittent, if it's continued, or just palabstine. And this palabstine is found in brucellosis and Hodgkin's lymphoma. Then you're going to ask about the diurnal variation of the fever. If it significantly rises in the evening, that's because of tuberculosis, brucellosis, and lymphomas. Next up, don't forget about the effervescence of fever. Now, if that subsides suddenly, that's because of malaria or pyelonephritis or empyema. And if that subsides gradually, that's because of enteric fever, tuberculosis, or just brucellosis. Next, you're going to ask about the relieving factors in which we can get antipyretic drugs. Also keep in mind the naproxen test for the neoplastic fever. Phew, there's a lot of detail about the fever. But wait, I think you want more. So let's talk about the associated symptoms with the fever. Now, to represent this fever, we're going to draw this ghost rider. Starting from top to bottom, we get the headache, which is represented by this headache cap. Now, if the patient has fever with a headache, that could be because of meningitis, encephalitis, or if it's the worst headache of their life, that's because of subarachnoid hemorrhage. Next, we can have sore throat that is represented by this red handkerchief in the neck. Now, if there's a patient with a sore throat and fever, that could be because of pharyngitis or tonsillitis. There's one more thing to add to the neck. These are electric shock signs, which are going to represent the neck stiffness. So, if there's a patient with fever and neck stiffness, that could be because of meningitis, encephalitis, or subarachnoid hemorrhage. What else are you going to ask about in a patient with fever? Well, you can ask for pain in chest, pain in abdomen, or pain in lumbar region. Now, if there's combination of fever and chest pain, that could be because of lobar pneumonia or simply pneumonia. If there's copious foul-smelling sputum, that could be because of lung abscess or bronchiectasis. Or if there's fever with hemoptysis and chest pain, that could be because of tuberculosis, bronchiectasis, or just pulmonary infarction. Talking about this pain, a pain can have different characters, and we're going to talk about that in the cardiology section coming up later. Right now, just remember if there's pleuritic chest pain, fever, cough, or hemoptysis, the causes are just respiratory. Now, that was pain in chest with fever. Well, can we also get pain in abdomen with fever? Oh, yes, of course we can. Now, if there's pain in abdomen and jaundice and fever, that's because of viral hepatitis or hemolytic anemia, or just jaundice and fever, that is because of cholangitis. So that's really the problem of liver and hepatobiliary tree, which you need to keep under strong differential. So just like pain in chest and pain in abdomen, there could be pain in lumbar region, and if associated with dysuria, that is because of pyelonephritis. So in pyelonephritis, you really get pain in lumbar region, dysuria along with fever. Next up, we can get combination of fever and joint pains, which is just arthritis, swelling and redness. Now that is seen in rheumatic fever, rheumatoid arthritis, SLE, and septic arthritis. So you really need to keep these diseases under your differential while dealing with fever and joint pains. Now there's another combination of fever, and that is fever with flamy urine known as dysuria. Just like this flamy iron chain dripping and melting in front of our ghost rider. Now if you get fever and dysuria, which is just flamy burning urine, you get pyelonephritis. Right now, we have covered a lot of pains. For example, pain in head, which is just headache, pain in neck, which is neck stiffness, pain in throat, which is sore throat, pain in chest, pain in abdomen, pain in lumbar, pain in joints, and painful urination. So these are the really strong associations with the fever you really need to keep in your mind while taking history. Now, that's a very long list of associated features. I think you want more. How about we talk about diarrhea? Now, as you can see, the Ghost Rider has dripping mud from his butt. Well, anyway, that is just telling us the diarrhea. Just remember that. Now, the diarrhea can really come in a lot of flavors. For example, watery stools, bloody stools. If it's watery, that's because of viral gastroenteritis. If it's bloody, that could be dysentery, ulcerative colitis, or Crohn's disease. Now, this doesn't look like a Ghost Rider anymore, and to add more to it, we just give him a bracelet in the thighs. And that bracelet is suspiciously looking like lymphadenopathy. Now, if there's combination of fever and palpable lymph nodes in cervical region, axillary or groin region, that could be because of tuberculous lymphadenitis or Hodgkin's, non-Hodgkin's lymphoma, leukemias, acute leukemias, infectious mononucleosis, and so and so. So you're really going to ask the patient with the fever if they can feel some nodules underneath their skin. Now, until now, we have really loaded things. Now, to take some out, we're just giving him weight loss. That weight fits beautifully with its burning metallic chain. Just before you see a patient with fever and ask about weight loss, keep in mind not every weight loss is significant weight loss. So make sure you're going after the significant weight loss only. Next up, if you see any patient with a fever, ask him about the rash. Now, if there's fever and rash, that is because of measles, chickenpox, rheumatic fever, or it could be drug reaction or SLE or infectious mononucleosis. So it's very important. Just ask this. So to remind you of rash, I have drawn these pinkish nodules all over his body. And it's done. He's no longer looking like a ghost rider to me. He's just looking like a psychopath who has just escaped from a mental hospital. So the final take-home message with the patient in the fever, if you don't find any fever, that is because of psychogenic fever. And just to remind you that fever is also associated with jaundice, just like we discussed in viral hepatitis or hemolytic anemia, we're going to give this clown a yellow tinge. To summarize this all, if you see a patient with fever, you're going to ask about the following: headache, neck stiffness, sore throat, cough, chest pain, pain in abdomen, pain in lumbar region, pain in joints, painful urination, diarrhea, lymphadenopathy, rash, jaundice, weight loss, or just it's psychogenic. Phew, we are done with the constitutional symptoms. And just as a refresher, we can ask the patient about sleep, weight loss, appetite, bone pains, night sweats, rigors, chills, and pyrexia, which is just fever.